Hi, can everyone see me? If you can't, I'll move over. That's fine. Yeah, thanks for letting us come down and chat to you all today. Before we get into it, we'd just like to also acknowledge and pay our respects to the land of the Wurundjeri and the Boonwurrung people of the Kulin Nation, whose lands we work, live and play on, and are here on today as well. We'd like to acknowledge their ongoing connection to community, to country and culture, and also just to acknowledge and pay our respects to elders past and present and any Aboriginal and Torres Strait Islander folks with us here today.
Beautiful. Cool. Great. Yeah, so hello everyone. We're going to be talking about, a bit of a snapshot of growth and evolution into the lived and living experience workforces across the AOD sector. But this will be centred around the discipline frameworks. So for those of you who don't know, in between 2022 and 2024, there was an amazing body of work undertaken called the Lived and Living Experience Workforce Development Program. And it was a $12 million investment by the Department of Health, and it was 69 projects across 7 lead agencies. And essentially, in a nutshell, this program of work was designed to scaffold a really, really massive growth in lived and living experience workforces across AOD and mental health. And included things like the discipline frameworks, training programs, various other projects involved. So there were 5 frameworks developed by 4 agencies. So you can see there's the harm reduction, lived and living experience peer workforce discipline framework, the AOD family lived experience workforce discipline framework, the AOD lived experience workforce discipline framework, mental health family carer and mental health consumer lived experience discipline frameworks. So you might be thinking, what is a discipline framework? There was a definition that was kind of coined and agreed on by everybody involved, and that a discipline framework is a guide that articulates the skills needed to perform a role in the field that the discipline is being implemented in. It establishes underpinning values and principles, theories and knowledge, like ways of knowing and working, and the scope of practice of a discipline. And the purpose of these frameworks is to increase the available knowledge and understanding of lived and living experience work, to add to the recognition of lived and living experience work as distinct disciplines as part of the holistic, pie that is our service system, to provide much needed clarity to our workforces and to the sector more broadly about lived and living disciplines, and to highlight the benefits of our work. Today we're primarily going to be speaking to the AOD lived experience workforce discipline framework and the harm reduction lived and living experience peer workforce discipline framework. Great, but just quickly, just want to give a bit of a snapshot of growth. Again, for those that don't know, because we've got the whole sector here, so it's a great time to kind of shine the spotlight on this and celebrate how far we've come in such a short period of time. So you'll see there's quite a lot there in a timeline which spans back quite far. I'm not going to go into all that, just sort of want to highlight a few key points. So in 2014 is when the first designated AOD peer work roles were funded in Victoria. 3 years later is when peer projects was established, and there was actually some solid training and support structures implemented to support that workforce, and that's when the AOD peer workforce community of practice was born. And we started with 4 AOD peer workers in that community of practice. That led to the AOD peer workforce strategy for Victoria being published, which led the work forward for a further 5 years or so. Within that, our future report was published, which was a research project to inform what needs to be embedded into a training for lived and living experience workforce, and a lot of the recommendations from that report was carried forward into the larger LU development program and the work done as part of that program. And today, this is a really big milestone for us in terms of us who are funded to provide the ongoing support structures to continue the capacity and development and growth, capacity building development and growth of the experienced workforce in Victoria, is that we've been essentially been given ongoing funding to continue to do that at the beginning of this financial year, which is just incredible. And now we have over 100 people in the community of practice as well. So a lot of growth and a lot of movement in a fairly short period of time.
Oscar. Dear me. added to that, we've also got a really brief mention of the milestones for the harm reduction peer workforce. So, I mean, we've been around forever, drugs have been around forever, people have been using them forever, and, we've been working in community forever. So in the 80s was when things really exploded. That's when funding really got handed out with, collaborations with various sectors in response to the HIV/AIDS epidemic. In 1987, harm reduction was funded. It was formerly known as VivAIDS, and we've since changed. And then along the way, we've had a couple of other things like the primary healthcare units that were set up in 2001 when we got, in 5 hotspots, we got dedicated services for people who use drugs. Then, in 2017, the department funded Reduplin. So that's the Reducing Harmful Drug Use Through Peer-Led Networks. Not a good acronym, just saying. So that was the first time that peer workers with living experience were actually employed in mainstream health organisations. And then over time we've expanded, and in 2021 we were funded for Fuse initiatives, which I'll give you a bit of a snapshot about what that's about later. Do you have to do that? Sure. Oh, cool.
Gotcha.
Oh, excellent. So just a bit about the harm reduction peer workforce. One thing you're going to notice is I call it that. We get referred to a lot as the living experience workforce. It's not entirely accurate. Most of us are living experience, but we do actually also have some lived as well. They're just, really passionate harm reductionists that are still closely connected to community. But in general, we sort of, we try to use the words that the peer worker community actually likes, and that's harm reduction peer worker. So those are people that are, having lived or living experience of drug use and risk of overdose, and they're employed in dedicated harm reduction roles in mainstream health organisations generally, and, they're all about, compassionate care, no judgment, and, no expectations either. We're just there to go where you want us to go. Oh, you're good. So in our framework, we've both just kind of selected a couple of little bits and pieces that we wanted to sort of chat to you about today. So one of the big things that, I wanted to chat about is the section on theories and knowledge. So, what's the evidence base behind all of this? Harm reduction has a really, really strong evidence base globally, which we're really, really proud of. But in Victoria, we're doing some pretty epic things. So, we've had a long history in Victoria of working with our community, and so many of the things that we do, there is actually, is it science? No, it's not science. Well, maybe it's science or maybe it's not, but these models, I'm calling them science. It's science to me. So they actually, underpin the work that we do along with our lived or living experience. So, being an empowering kind of force in community, actually talking, getting out there, using our knowledge that we have on the streets of what drugs are hot, what are not, is there any adverse things happening out there? We use that every single day in our work. And, we also understand that with like social learning theory, they found in the 80s with the AIDS epidemic, it was actually really, really foresighted of the Department of Health then, because they actually recognised that people actually understand and take on messaging regarding health from trusted peers a lot better than they do a doctor, a nurse, some clinical person who may or may not get it. So it was really great that they actually put a lot of effort and funding into that. So then, we've been able to hit the ground running, getting NSPs up and running, we've got the injecting room, drug checking, like all these awesome things. And, so many things, they're made better by having harm reduction peer workers in, simply because we do get it and we don't have, any expectation of, abstinence or changing your drug use unless that's where you want to go. The other section that I wanted to really highlight was this practice support section. So it's not special treatment that we're advocating for, it's specialised treatment for a specialised workforce. So, we are advocating for all harm reduction peer workers should be getting, external clinical peer-led supervision. So often we get given supervision, it's actually line management. I mean, yeah, great. But, we want actual proper supervision with someone who also gets it, has walked that channel, done the hard yards in the trenches and, is able to actually go through that mutual learning, co-reflection in that space with us, but orgs, you've got to pay for it, because it's vital. So many times we hear that, peers are asking for supervision and their orgs just can't pay for it. They don't have the dollars, so we're getting peer workers paying out of pocket. And I mean, I don't know, a part of me feels if you can't afford to support us, you can't afford to have us. So when you're doing your funding bids, include all of that. Also with, training, we need to be getting peer-led training, in addition to our manual handling and all of that jazz, let us have that time, on paid time, by the way, to go get adequate training. It's got to be peer-led and peer-delivered. Very important. It's also really important that, we get time, paid time, to go to networking things. So, whether it's a community of practice, whether it's a conference like this, it's really difficult because often our peer workers, they're working part-time. So their capacity to actually go to these things is, reduced anyway, but then it's even more so, particularly because so many orgs keep hiring peer worker, like one out. You can't do that. It's not good practice. You need to have, a buddy when you're doing peer work, someone else that actually gets it too. So, hire at least two, please. Also, sorry, that wasn't ready.
Sorry.
You're too fast for me. But it doesn't just stop with, the things that the peers need. It's also about what the organisation needs. You need to do organisational readiness training. Check your pulse. Are you culturally safe for peer workers? So often, you think you are, you might be, but when you look at the nitty-gritty, you've got to check your policies, check your procedures, nothing discriminatory. Also, don't give us special policies that are just for us. We don't want that. The funny thing is, the things that will actually benefit us will actually benefit every other worker. So, we don't need specialist policies, please, but, just make sure that we're included in your policies, and no drug testing at work, please. And also just training in general for, staff working alongside us. It can be a bit confronting for some people, not knowing, how do you deal with this person who is using drugs, because that's why they're hired. What does that look like, and just what does peer work look like? That's very different kettle of fish to what everybody else is doing in the workplace. So getting that really good understanding through training as well. Okay, now I'm ready. We've got our own values and principles that were developed by the harm reduction peer workers. I'm not going to go through them all, but it's all about empowerment. It's all about grassroots community engagement, meaningful involvement, and just acknowledging the harms that have been caused by numerous policies, laws, all of that stuff. Over the years, it's not just a war on drugs; it's a war on people who use drugs. So let's stop that too, please. Okay, so before I hand back over to Oscar, I hear you asking me, Mills, what about implementation? Well, there's a lot that, watch this space, it's happening as we speak. But we do need to look at reducing stigma towards all people who use drugs. We need to get vocal organisational support for your harm reduction peer workers. We need to get some protections for peer workers. We do not work and be protected at all under anti-discrimination. We've looked at all of the Equal Opportunity Acts and all that. We are not protected, and we need to be. But the elephant in the room that I also hear you ask me is what's missing? Well, we need some drug law reform, people, because, without that, this can only go so far. So, at the moment, we're in a really weird spot where our harm reduction peer workers, they're valued, they're, really acknowledged and believed in by the Department of Health, and the Justice Department want to lock us up. It doesn't work. You need to, pick one, but we need a whole of government strategy to actually, change this whole scene, because, that policy to people at the moment, we're lacking. So, we need decrypt immediately.
hub your work, Meals.
Thanks, Oscar.
Great. So, now I just really want to give you a snapshot of the AOD Lived Experience Workforce Discipline Framework. So I guess first of all, like who are we? Who is the Victorian AOD Lived Experience Workforce? So this section of our framework really begins to describe our identity as a workforce in lived experience, lived expertise, practice expertise, gives a breakdown of the kinds of roles that exist and how sophisticated we've actually become. As well as what makes up an AOD lived experience worker. And then here you can see a bit of a visual of the different kinds of roles that currently exist within our workforce now today, and begins to paint a picture which is expanded upon in the scope of practice and core skills and knowledge sections of the framework that allows the primary purpose and unique benefits of each specific role within the workforce to begin to be really clearly utilised and understood and implemented. And this is really important because for a long time, I guess peer work was viewed as a bit of a stepping stone into the sector. You might employ a really great peer worker. They want career trajectory. It doesn't exist. They step away from the lived experience workforce. That's no longer the case. We now exist in a place where it's growing and it's being implemented at more and more levels, and it's happening really, really rapidly. Cool. So now just to touch on our values and principles as a workforce. So these are really instrumental in guiding what underpins our approaches and what's most important for us to uphold in the work that we do. And there was a lot of extensive co-design consultation and consolidation that took place to actually develop these with our workforce. So this is what our workforce says this is what is the most important in what we do. And at the very top we have lived expertise, and I just want to hone in on that for a moment because really it underpins all of our other values. And this is the idea of when we talk about, okay, what do you need other than lived experience to step into the lived experience workforce and to step into peer work? And this is about how we actually integrate our lived experience. What kind of journey have we been on where we've got some distance between the peak of our distress and the adversity that we've been through and where we are now? What new coping skills have we learned through that healing journey? And how have we integrated that into our lives, into our relationships, into the way we carry ourselves and into the way we work and into the way that we represent ourselves as a professional discipline. So now I'm going to talk to the scope of practice. So this section of the framework is really critical in framing up what the scope of our work is. How we do things like what the roles are responsible for, particularly implementation of lived experience is more important. It's about what we do on the ground, and it breaks down some specific areas of lived experience implementation within the workforce in the roles that exist and the scope of those roles. Great, and then finally we look at core skills and knowledge, and I'm just breezing through in acknowledgement of time. This section breaks down the core knowledge and competencies required for the AOD lived experience workforce, as well as role-specific competencies. So this part is really important in allowing the primary purpose of particular roles to be fulfilled and the lines to not get blurred. Because for a long time, I guess, with peer workers on the ground, in terms of implementing lived experience at different levels within a service or within the service system, a peer worker would get brought into a service and that kind of responsibility would fall on their shoulders, and they'd have to think about being in really difficult positions of how to actually do that, and without adequate training or without having the support to be able to do that effectively. Whereas now, peer work roles on the ground can focus on what they're meant to focus on, which is building relationships and walking alongside service users and supporting them through identification through their own experiences. And now we actually have roles that focus on, advocacy and consultancy and implementing lived experience for the purpose of creating systemic change. Okay, and then finally, I'd just like to give peer projects a little bit of a plug, but for the purpose of, again, shining a bit of a spotlight, right? Because we are funded to provide really highly regarded and highly recognised but non-accredited discipline-specific training for paid AOD peer workers in Victoria. So if you have peer workers that have not done the training, get them into the training. We deliver 3 funded trainings every year. We also hold the Victorian AOD Peer Workforce Community of Practice, which we hold every quarter, which again is incredibly important networking and ongoing professional development for the peer workforce to be involved in. So please, if your peer workers are not engaged in our community of practice, assist in engaging and let us know about them, because we know that we have over 100 people in our community of practice, but we also know, I've even been sitting here today learning about peer workers working in places that I've never heard of. So yeah, opportunity to really get them involved in the supports that are being funded for them. And there's our information if you want to get in touch. So.
And I'm just going to do a really quick plug for Fuse. So we're essentially the equivalent for the living experience peer workforce. So we also have, it's a NOPE, essentially. It's a network of practice excellence. It's essentially, it's a COP, but we don't like that acronym either. You know, we've had enough of COP, so we went with a NOPE. So it is a lot smaller, but it's we're a growing workforce. So, you know, we've got some really active members and, you know, lots of learning and sharing is happening in that space. We provide supervision as well, org readiness, and, you know, peer training as well. If you'd like, you know, check us out. We've got the QR code there again for the framework. I do have some hard copies with me. If you want one, my bag's super heavy, yeah, so like come and grab one. Otherwise, be environmentally friendly and just go online and grab it. Thank you.
And just very quickly, I just really want to mention as well that, like, I guess these frameworks, just really want to highlight that one of the reasons it's such a huge thing is that for so long we've been in a space of, you know, we're rapidly growing, we're rapidly developing, we're rapidly changing, there's always new learnings, and we're yet to reach a benchmark that says this is the best way to practice this kind of work. These frameworks are arriving at some kind of benchmark that actually says this is how the lived and living experience disciplines within our workforce is supposed to look. So please, if you're not familiar with them and you've got lived experience workforce, familiarise yourself with them. It helps with role clarity, it helps with creating a shared vision within your organisation. Really, our work should be informed by these disciplined frameworks from now on. So please familiarise yourself with them. Thank you.
Well done.